Hello! I wanted to do a quick update on my second and third week of knee surgery recovery. After my first physical therapy appointment at the end of my first week of recovery, the pain in my knee stayed pretty consistent for the second and third week of recovery, and then it would just be a little bit extra sore after each physical therapy appointment. I was able to bend my knee to 86 degrees at the end of week 2 and to 97 degrees at the end of week 3, which is just totally shocking to me because of how little I could bend my knee at this point last year. I was allowed to start putting 50% of my weight on my leg at the beginning of week 2, and I was allowed to keep my brace unlocked when I was walking with crutches, so I could start walking a little bit normally, like bending my leg as I walk. And I wasn't allowed to do any of that stuff until like week 5 or 6 last year, so I'm really happy with how fast the recovery is going so far. Since we're not focusing as hard on bending my knee as we were last year, we're really just working on getting my thigh muscle to work again. Your muscles do start to shut down if you don't use them for even just a couple of days, so that did happen to me during the first week of recovery. I have to use an electrical stimulator at PT to get my muscle to engage. I had to use that last year too, and I really don't love it. I really babied my leg last year. I was lifting it with my hands whenever I had to move it, so I had a really hard time getting that muscle to engage. So I'm trying really hard to make my leg do the work this time. So by week 3, I didn't have to use the electrical stimulator anymore, which is awesome because I really don't like that. It makes me sweat so much. I don't like that. I've been taking aspirin once a day to prevent blood clots. I had to do that last year too, but this year my body is really not responding well to the aspirin. So I talked to my doctor about it, and now he's having me take a baby aspirin twice a day. So we'll see if that makes a difference. For the entire second week of recovery, my ankle got progressively more swollen throughout the week, and I was actually surprised that it wasn't swollen during the first week. Last year when I had surgery, my whole foot and ankle were swollen from when I woke up from surgery. So I was surprised that that wasn't happening this time, but it happened during week 2. So I just iced my ankle just as much as I iced my knee, and by the third week the swelling was gone, but my whole entire like shin and ankle really just feel like a big bruise. But I didn't mention in my last update that the actual visible bruising was much less this year than last year, which was awesome, but it still feels like a big huge bruise on my leg. My sleep schedule sucks. I'm having a really hard time getting comfortable in bed, so I'm not really able to sleep at night, and then I go to PT and I'm super worn out when I get home from there, so then I fall asleep and like sleep all day, and then I can't sleep the following night. So it just turns into this vicious cycle because I'm going to PT 3 days a week. This did happen last year, so I did expect this to happen, but it is just so frustrating to me, and it's even happening right now. I haven't slept in over 24 hours right now, but I'm just gonna force myself to stay awake, so maybe I can actually fall asleep tonight. We'll see. When I do sleep, I do usually sleep with a pillow underneath my knee just so it's bent a little bit. I find that sleeping with it bent at this point is more comfortable than sleeping with it just like flat straight out, but I am sleeping on my back, which I don't love. I'm a side sleeper, but I can't really figure out how to sleep on my side right now with this knee, so sleeping on my back with my knees bent. Another issue that I'm facing this week is that my whole leg is just itching so much. And it's just because everything is like healing in there, and that's why it's itching. And my PT always tells me like, do not even itch because you don't want to mess up anything that's like happening in there. You don't want to like mess up any of the healing from the inside. And honestly, scratching it doesn't even help because the itch is coming from so deep inside of there. It's actually kind of gross, but the itching, oh man, I can't wait for that to stop. I had my first follow-up appointment with my surgeon, and I don't have any pictures or x-rays or anything to share yet, so hopefully in my next update I will after my next appointment. But my doctor was really happy to hear that everything is going so much faster and so much less painful this year, and then he shared this crazy story with me. So he said that after I was already knocked out in the operating room and he was getting ready for surgery, someone had gone over to me and looked at my knee and said, "Why does her knee look so weird?" And he came over and looked at it and he was like, "That's because it's already dislocated." So it turns out that when I was laying on the operating table and I was knocked out from the anesthesia, my body was completely relaxed and my legs were straight out in front of me. So my kneecap just slipped right out of place. And that doesn't surprise me. I have woken up many times after falling asleep on my back and not being able to move that leg when I woke up in the morning because the knee was dislocated. So it doesn't surprise me. It really grosses me out to hear that though. Like, I guess it really just needed to give out one last time, but my doctor said that he took a picture of it and he's actually going to be using me as an example in his lectures about this sort of thing, because the extreme instability in my kneecap was apparently very unusual. He also told me that he's changed a few things in the way that he does the surgery to make the recovery a little bit less painful. So that does explain why I was feeling so good during the first couple days of the recovery. The problem that I'm facing right now is that my knee needs time to heal, but I've already reached the limit of how far I can bend it for the next few weeks. This is just so wild to me because it took me until like week 6 last year to be able to bend my knee as far as I'm bending it right now at week 3. But I'm not allowed to bend it any further until the bone and the ligaments have more time to heal. So I'm kind of just stuck here. This was not an issue that I was facing last year. It's not a bad thing, but I'm just starting to feel impatient already. Hopefully I'll have some x-rays to share in my next update. I'm really excited to see my newly realigned kneecap because this knee was resting so far out of place, but I didn't realize it until I had one knee fixed and then this one just like floating off wherever it wanted to go, and I could actually feel the difference. So I've been waiting a really long time to have this knee fixed, and I just am really excited to actually be able to use it. Thank you for watching. Give this video a thumbs up, subscribe to this channel so you don't miss any future knee update videos, and follow me on Twitter and Instagram. Those links are down below.